Varicose veins are one of the common conditions that we come across in our practice. These are dilated tortuous veins in the legs, and they can be simply asymptomatic, just being a cosmetic problem to the situation wherein they can cause complications and ulcerations. This is quite common in any age group, and usually they result from degenerative valve changes, or in some patients with clot formation in their legs, and various other causes include the familial history, and sometimes you cannot find what is the cause. So the symptoms that these varicose veins cause will be, to begin with, a simple ache in the legs, the cramps, swelling in the legs, tiredness in the legs, especially at the end of the day after a strenuous day's activity, especially, and the people who stand or sit in a position for a long time are particularly at risk of this. And other symptoms include the presence of the veins themselves, the skin changes that occur, and sometimes in later stages they can have ulcerations which are difficult to treat. Your vascular surgeon will conduct a clinical examination, and he will order some investigations like Doppler venous study to identify which part of the veins are involved and what treatment to cater to customize treatment for these diseases. So initial stages, you could use stockings and take some medications, or in stages where it needs to be treated or it's going for complications, we advise minimal invasive endovenous thermal treatments in the form of, say, endovenous laser treatment or endovenous radiofrequency ablation. These are the very patient-friendly procedures. So it can be done as a daycare procedure. At the end of the day, patient gets discharged and gets back to their work immediately. This is much more relevant for today's times, when the time is very important, and many of the patients prefer this because this tends to be painless procedure and there is a faster recovery. And in patients whom we cannot offer these treatments, we have surgical procedures in which we do the saphenofemoral junction ligation and stripping of the vein. And most of the important thing that is, patients will have to wear stockings for a certain period of time to maintain long-term results. To prevent varicose veins from recurring or from developing, my advice would be to keep a healthy lifestyle, reduce your weight, exercise regularly, and keep a check and visit your doctors regularly in case you have some problems. Thank you.